I'm Dr. Tyler Harvey with State of Franklin OBGYN Specialist. There's relatively few times in people's life that are as memorable as giving birth. Being a part of that is an amazing opportunity. You get to go through the process of what it took to get there as they start through that process of fertility. Some people struggle with infertility, and so being able to guide them through those processes and hopefully end with what ends up being a delivery of a baby is an amazing process. And then you can kind of navigate the rest of their life. And so you get to follow these patients from a very early beginning all the way through menopause and beyond. So it's a pretty amazing field to be able to go through that entire process with them. When you grow up in this area, you have a very common bond with people. You kind of know what they've gone through, how they've grown up. Whenever you can sit down and just have a good rapport with people and good bedside manner, as well as having gone through some of the things that people struggle with in our field. My wife and I struggled with infertility for a period of time. We had a miscarriage, so being able to go through those processes and know what that feels like helps you to guide your experiences with patients. So to know what the expectations are, what their fears are, what their concerns are, I think it gives you the ability to connect with patients that are going through similar situations. Minimally invasive surgery is typically a surgical technique that you're trying to minimize trauma to the body. Previously, we used to do surgeries that had long recoveries, big incisions, and now we're doing surgeries that involve small incisions. Most of our patients are outpatient surgeries where they go home same day. And so most of these techniques are used to minimize recovery. When we've been able to do that, you see a lot of quality of life improvements, as well as people's ability to do surgeries when they thought that maybe they wouldn't be able to do those. So I always have open discussions on all the aspects of how we do surgery with patients. Different pathology requires different surgical techniques. Sometimes it may require us to do things laparoscopically or with the robot. Sometimes it may be something that we can do where we don't have to make any abdominal incisions, we can do everything vaginally. But we go through all the different options with patients, give them an opportunity to ask questions about the different routes that which we do them, and kind of make a combined decision on the best route to do. Surgery is a lot different now than the way it used to be 20 or 30 years ago. So the way we do hysterectomies is not the same as the way we did when their grandma had surgery or even their mom had surgery. And so there's different aspects of what people expect from surgery, how much time they're going to have to take off, the amount of pain they're going to have, as well as the long-term impacts on these types of surgeries and how that pertains to sexual function, bladder function. Most of the patients that we impact with these decisions come back in their post-op period and say, if I'd have known it would have been like this, I would have done this a lot earlier.